Everyone, once again, welcome to my YouTube channel. So today we will have another one role play. This happens in emergency department, and we are going to talk regarding allergic reaction. Moreover, I would like to tell you that this scenario is non-scenario because they have given you have just examined his or her face. So if you saw this phrase, you should not start with your self-introduction. Actually, here no need for self-introduction because already you have examined the patient. Anyway, we will have the settings. So this is emergency department, and your role is you see a 60-year-old patient who has come to the emergency department because he has a swollen face which he thinks started while gardening yesterday. You are seeing the patient in triage for assessment and have just examined his face. You suspect an allergic reaction, so you can note it out. You have just examined his face and you are suspecting allergic reaction. This is not confirmatory diagnosis, you are just suspecting. Okay, so you have to be in the scenario. Now we are sitting in front of one patient and he already you have examined his face and the problem is on face, and you are suspecting some allergic reaction and you are getting some information, then you will give the advisor. So we will see the task. The first task is confirm the presence of swelling. Find out about any other symptoms like nausea, vomiting, skin irritation, breathlessness, etc. So how we can ask during 3-minute preparation time, we have to ask the patient how may I address you during the role play. Example, patient told you to call James. So we can start like this. Well, Mr. James, thank you for allowing me to examine your face. Upon my examination, I can see that your face has swelling. Before proceeding further, may I ask you some questions regarding your general health? Then it's like a asking permission. Then patient may inform you, yes, of course, sister, you can. Then we can ask, could you please tell me, do you have any other symptoms like nausea, vomiting, any skin irritation or breathlessness, something like that? Then patient is telling that no, actually I don't have anything except itching. So on that area I have some itchiness. That's only the thing. Then we can the next task is we can explore any remedies tried. I mean, we can ask how they have whether they have tried any remedies like over the counter or antihistamines. Then we can ask like this, Mr. James, did you have any medications at home like over the counter and antihistamines, something like that? Then patient is telling that no, actually I just washed my area face with a soap solution. That's only the thing what I did. I didn't have any tablet. Then we can, and the next task is ask about any history of allergic reactions to food, medicines, hay fever, insect bites, or string, etc. Then we can ask like this. Actually, I would like to ask another one more question. Do you have any history of allergy reactions before, such as any reactions to food, medicine, or past history of hay fever, insect bites, or sting, something like that? Then patient is telling that no, actually I didn't have anything in the past. This is the first time for me. Then our next task is give a likely explanation of the patient's condition. Maybe it is allergic reaction to plant or pollen. Okay. Then we can tell like this. Well, Mr. James, thank you for your explanations. And from your conversation and my assessment, what I can tell you that this is most probably allergic reaction to plant or pollen, because you told me earlier from yesterday onwards after gardening you have got this allergic reaction, isn't it? So we got the idea from that scenario, so we can add here. And maybe most probably this allergic reaction is due to plant or pollen because it's happened in garden. So are you getting my point? Like that we can ask. The next task is explain the next steps: examination, treatment by doctor, likely prescription of antihistamines, etc. Then we can tell that. But no need to worry, Mr. James, you are in our safe hand. And further, what we are going to do is you will be examined by the doctor, and of course he will treat you accordingly with your conditions. Most probably he will prescribe you antihistamines because the patient told that he didn't take any medication at home. So are you okay with that? We can ask like that. And the last task is resist request for time scale, like if it depends upon the availability of doctors, number, and severity of the emergency cases. Ask the patient to wait to be called to see the doctor. And but from this task, we can come to know that patient is in a hurry. So he's asking regarding the time scale of consultation. So then maybe Then we can ask that, do you have any concern? Patient is telling that, sister, actually I want to ask you that when I will get consultation with the doctor. Actually I want to go early to home. We can tell that, I can truly understand your concern, Mr. James, but no need to worry. I can reassure you that doctor will come as early as possible. But really, I'm sorry to tell you the exam time scale, because it will depends upon the availability of the current doctors in emergency department and number and severity of emergency cases in between. If there is any emergency cases, of course, everybody will be busy with that cases. But once again, I'm reassuring you that please wait here for a while. I will go and check the availability of emergency doctors, and of course I will get any of one doctor for you. So is it okay for you, or how does that sound? Like that we can ask. And then the last task is ask the patient to wait to be called to see the doctor. Then we can tell like this, for now you can just please wait here for a while, let me go and get your doctor. And in between we can ask, before that we can ask, do you have any other concern, Mr. James, to be clarified? Then he's telling that, no sister, I don't have any other clarification, please get me the doctor fast, because I want to get some relief as early as possible, because it started to itch, something like that. Then we can assure, once again we can assure the sentence, once again I am reassuring you, Mr. James, no need to worry, you can just wait here for a while, I will get your doctor without any delay. Is it okay? Then patient is telling, yes, okay, fine, thank you. So that's only the role play. Actually, this is a small role play card. Mostly you will get it in first role play. So it will be small enough to get points. And for preparation, you will get anyway only 3 minutes. But for presentation, you will get enough time here. But in this emergency scenario, you have to keep it in your mind. You have to give more reassurance to the patient, because it is emergency situation, not same like hospital ward or anywhere. So you have to give more reassurance, and the trust should be there between you and the patient, that he will get a better care even if she or he waits there. And of course, this is a common scenario that patient has to wait there, so you have to give the reassurance. I'm reassuring you that it will not take long time, as early as possible I will get your doctor. Until then you can just wait here, like that. So you can use these sentences and all, like in common way. If it comes for emergency department and the tasks are same like this, means you can use the same sentences. So I hope it is clear for you. We will see you with another one informative role play. Until then, bye, take care.